coronavirus hit the United States in March, schools shut down. Businesses were closing, and even child care providers were forced to stop. But child care must continue because it is essential in order for parents to return to work and because child care plays an important role in the development of a child's life.
Child care is considered birth through 12, and early education, research has shown that early education is essential for the healthy social emotional development of children. This leads to higher kindergarten readiness scores, it leads to future success in school, and eventually it leads to a well-prepared workforce.
The Office of the County Executive was hearing from members of the community and child care providers that child care providers could open, but they had new rules to follow.
As the pandemic unfolded, we heard about different needs that come up through health and human services, types of nonprofits, individuals reaching out to the county executive and so forth, and it very quickly became apparent that child care providers were being disproportionately impacted by the pandemic. What happened to them is that they were abruptly closed without warning in March. And when they were told they could start to reopen, they had to reopen with certain restrictions. And those restrictions included fewer children in the classroom, and it meant that they had to do this rigorous cleaning and disinfection that they had not done before. And all of those things have come at a cost, either to their income, their time, or the expenditure of additional funds.
Essentially everything about childcare and education is totally different with COVID. As the situation changed and developed due to COVID, some additional requirements included the cleaning of high traffic surfaces every hour within the center. Now we are in a 6,000 square foot facility, so that is a lot of surface area to clean every hour. To also clean educational manipulatives, classroom items such as tables and chairs, and even our playground equipment has to be sanitized per those guidelines after every use. Patty reached out to providers on August the 11th requesting information and data regarding how much cleaning costs have increased due to COVID-19 specific to child care centers. In an effort to be transparent, I sent her a whole breakdown and a list of our costs and how that shows that they've increased by over 250% just in our regular daily cleaning costs.
County Executive Jan Gardner, Deputy Chief Administrative Officer Monica Bearden, and Program Director of Child Care Choices of the Mental Health Association, Patty Morrison, put their heads together to come up with a solution to help child care providers financially. And grants were on their way.
And in developing the grants, we had an online grant application, so we had a lot of support from our IIT team as well as from our staff in economic development. We really didn't have any staff assigned to specifically address childcare. It's not something we normally do in Frederick County government. So I'm really pleased that people stepped up to spend some time and energy to make sure that we could get money out into the community for our childcare providers so that parents would have the ability to have quality childcare for their children.
Once child care providers in Frederick County were approved for the grant application process, the funding provided from the new child care grants substantially helped with the funding for additional cleaning costs. Child care providers in Frederick County received the grant funding on August 31st, but had to ensure they remained open for at least 4 months.
What we did is we determined that we could objectively measure what the costs were for cleaning and disinfection. So that's the daily cleaning and the routine disinfection of all the surfaces in a family's home for the family child care providers, a small center or a large center. And that was done by getting a number of quotes. So it's $4,100 for each grant to a family child care provider, $5,100 for each grant to a small center, and $6,800 for each grant to a large center, solely based on cleaning and disinfecting.
The coronavirus pandemic had child care providers scared that they were going to lose their business. Even child care providers that were able to return and meet the state-required capacity limit for how many children can be in the center at once were worried of exhausting their funds for the new cleaning procedures put in place. But now, child care providers are ecstatic to receive the child care grants, and they are confident that their child care provider business will continue to run efficiently.
Some of the providers I have talked to, some of the center directors have gone into their retirement funds, others have gone into personal funds, others have depleted cash reserves. Family child care programs, I'll never forget this, the day that the press release came out with C.E. Gardner, one of those providers, it was a family provider, contacted me and said, I was just going to tell my families tomorrow that I didn't think I could do this any longer.
I've been very pleased with how the child care grants have worked out. We've had many of our child care providers apply for the grant. The money is going out right now to them, and we've had a number of providers tell us that it has helped to keep them financially alive and to sustain them during this difficult time.